Welcome, everyone. We want to say thank you to Papalex for sponsoring this event. Dr. Nguyen and I are very honored to be talking about this topic and this presentation about something that we feel that needs to be talked about more, and we hope that we can help as many of you that are here today and those of you who are listening to the replay to make sure you have more tools and resources to help support you and that will help you in your journey and give you less stress about managing HPV. Take time now to turn off distractions. Connect with us by using the Zoom chat. We are so happy to hear people are coming in from all over the world, and we want to keep that chat going. We're going to try to make this an interactive and workshop style experience for you. There is a Q&A at the end. So we have a Q&A tab where you can leave your questions. If you're listening to the replay, you can send us your questions as well. We do have a little surprise for you at the end. It's a gift. It's a helpful resource that was created just for you based on this specific webinar. So we think you're going to find it extremely beneficial. So wait till the end to find out more about that. And our goal today is really to address the impact of the emotional stress that can be experienced when dealing with HPV and how key it is to have strategies to manage stress for your immune health, to highlight the importance of optimizing immunity with evidence-based immune supportive strategies to help you feel more knowledgeable and empowered about how to proactively approach managing HPV. And we also want to ensure you have accurate information to guide you. And what we'll be covering, I'll let Dr. Nguyen share that with you.
Thank you. And so we really want to make sure that we cover some basics of HPV and its impact, and really focus in on why talking about it openly will help manage the emotional impact that HPV can have. And we're going to focus on 3 strategies to help move that into an area where you feel comfortable. And so the first one I'll be covering is HPV education, awareness, and getting the support that you need.
And then I'm going to be talking about self-care strategies to really manage and reduce emotional stress for the purposes of immune support and evidence-based nutritional and lifestyle strategies for immune support and how important those can be as well. So I'm honored to be introducing my colleague, Dr. Nguyen, who is a board-certified OBGYN based in the US and prior chief medical officer of a large health system in Texas. She, in addition to all of that, is now focusing on pioneering really important, in my view, pioneering projects that rethink traditional healthcare solutions and is challenging taboo topics to help break down unnecessary stigmas in healthcare. And that's how we aligned. I feel very strongly about this as well and the importance of talking about this and making sure that people have more resources at their fingertips to manage the emotional journey that also comes with the physical symptoms and the diagnosis. And I want to make sure that you leave here with more information as well. And I'll let you add to this as well about yourself.
Just really, thank you, Christine. I'm a mother of 3, and I am really focused on, like Christine mentioned, different ways of approach. And that's exactly why we connected, which I can't just so thrilled to share with y'all what we have packed and ready for y'all this hour.
Absolutely. And just quickly, I am Christine Matheson. I am a naturopathic doctor in Canada with a focus on women's health. I'm also the director of education for a dietary supplement company that supports cervical health. And as you'll find out on some of the stress management strategies I'm going to share, I was a yoga teacher for many years as well, including in a hospital setting as part of an integrative healthcare program. So we're thrilled to be here with you. And we want to, as I said, make this interactive. So please join in the chat with any, any comments you have or any questions. Go to the Q&A tab and add those, and we'll have a Q&A at the end. As always, it's important for us to emphasize that the information and content provided in this presentation is for general and educational informational purposes and not professional medical advice. So if you have any concerns, please do talk to your own healthcare provider. So I wanted to really emphasize that HPV is in the news and to talk about how relevant that is because there's a lot of initiatives happening globally to improve HPV testing specifically to help catch HPV diagnosis sooner, to hopefully help more people sooner. So here in Canada, this is an article from British Columbia showing that new self-screening programs have launched, and the idea is to detect HPV sooner. And Dr. Nguyen is sharing some articles as well from other places in the world.
Yeah, so these few articles that I highlighted here are based in the US and very recent. But I just wanted to highlight that there's a lot of focus in looking at the accuracy and effectiveness of the samples of HPV testing if it's self-collected, which would really improve screenings. And there's a really a broad effort to normalize the screening and integrating it into our daily practice. So we are going to jump in and cover some basics here on the human papillomavirus. So HPV is a very common virus with more than 100 types, of which at least 14 can cause some form of cancer. Some cause warts or papillomas, which are non-cancerous, and others can lead to cancers such as cancer of the cervix, of the anus, the throat, penile, vulvar, and vaginal area. Now, the main way of transmission is through intimate skin-to-skin contact. Oh, next slide, please, Christine. And so skin-to-skin contact is how it's transmitted. So you can imagine most sexually active men and women will be infected at some point in their lives. Most of the time, they will have no symptoms. And so next slide, please. This slide here, I wanted to highlight the number of new cancer cases diagnosed across the world this last year. You'll see the majority is cervical cancer. And then you'll see the incidences of the other types are quite low and lower than the cervical cancer. And I wanted to share this slide specifically, not to scare you, but really highlight the good news that the incidence of these other types of cancers are still quite small relative to cervical cancer. And we're just really on a good momentum right now to continue to work towards better screening. Next slide, please. And so how do you know if you have HPV? Very traditional screening here shown in the photo is a pap smear. So a pap smear is our screening procedure for cervical cancers where cells from the cervix are looked at more closely to see if they look abnormal. Now, an abnormal result doesn't necessarily mean that you have cancer. It just means that there are some cells that don't look normal. And that's why the continuous monitoring is very important. Now, since the traditional pap smear was introduced 20, 30, 40, 50 years ago, the worldwide rate of cancer has reduced, for cervical cancer has reduced by 40%. So we know screening is really, really important. And in more recent years, in the last decade, there's been this introduction of HPV testing only. And so every region has different guidelines, but say, for example, here in the US, you can have a combination of HPV testing with pap smear, depending on your age range. And it helps not only detect abnormalities earlier, but it allows us to extend the timing in between screening, which I think has been really helpful for women and trying to balance their busy lives to know when the screening is appropriate and keeps them safe. And so I want to talk about for the next slide, Christine, around a little bit more about the self-testing option. So I don't know if you all have heard of this, but please put in the chat if you have. We'd love to see how common or not common this information is. But more recently, there has been home HPV testing kits that are becoming more available and accepted. Some of the studies that I alluded to earlier are really trying to see how accurate they are and how effective they are. But this allows the individual to collect the sample themselves in whatever environment that they feel the most comfortable. And then this will help us detect HPV earlier. Now, right now, the HPV testing is only available for women. There are continuous studies looking at how we can make this also very effective and make it practical for men to use as well.
Just curious, as I said, we want to interact with you. How many of you've heard about this new HPV testing or heard about it in the news? it's definitely going to be a big initiative and a big change that you're going to notice in your healthcare. So chime in and share with us like where you are in the world. Some of you shared at the beginning, we have an international audience. So I'm curious because this is going to be a changing face in this field.
Yeah, absolutely. And I think it is quite common actually to hear from my own, colleagues in my area that they aren't aware. And so we really are trying to help push awareness around this.
Mhm.
Just a few more things here around conventional strategies. I mean, another component of the approach to HPV management are vaccines. And it's really important to speak to your doctor about what is best for you and your health conditions. There are currently a few vaccines on the market, and there's always ongoing research to understand different and new methods to offer patients options. Um, Staying updated on the research, just, as we talked about, the self-testing for HPV is really important so that you can feel empowered to go to your own doctor and ask about things that you're reading about, from, the World Health Organization, and really a lot of worldwide efforts from a lot of different countries trying to minimize and, eliminate the impact that HPV has. Um, Other efforts that are going on are just trying to increase the screening, specifically for underserved populations, and trying to provide mobile health units or telehealth services. And so this is just ongoing research for even non-vaccine related methods as well to help prevent the progression of HPV. Let's see, next slide. So we're going to switch gears a little bit here and talk about really the reason why Christine and I connected, which is the emotional impact that HPV has when on individuals and their families and friends. It's very common for HPV to cause a range of emotional reactions: fear, frustration, guilt, shame, isolation. And the challenge here is that this stigma around HPV exacerbates this range of emotional reactions, and it can sometimes make the individuals less likely to seek help or share their experience. And so I wanted to take this moment, and Christine, we can stop sharing if that's an easy thing to do, but
Sure,
I
yeah.
wanted to share, this year I created a anonymous health platform so that I could learn what type of questions people have and what are they willing to share when they don't have to share their identity. And so I got a lot of questions around HPV, and that has shaped a lot of my work recently. But I wanted to share two quick stories because I think it highlights some of the things that we think we know, but it's really different when you hear from someone. And so I had a young woman reach out to me. She had just finished college. She was starting her work, and she was diagnosed with an abnormal pap smear a few years back. And though she had heard of HPV, she didn't think that she had risk factors for it, right? So it was a real shock for her, and it led her down this tunnel of shame and guilt and fear. And she continued to test positive for HPV over that time. It really added to her anxiety. And so when she reached out to me, she was having anxiety to the point where she wasn't sleeping well, and she felt very isolated from her friends and family, because it's just not something that is easy for people to share. And many, many women who reached out were in that, that category. On the
Mhm.
flip side, I actually had a husband reach out to me to ask for advice. His wife, and they've been married for several years, had a recent abnormal pap smear. She had a history of abnormal pap smears, and so likely what was happening was something got reactivated.
Mhm.
And it really affected their relationship and their intimacy. Um, but there was, some of the details he was sharing, it was really based on misinformation. But I'm glad that that's what triggered him to reach out so that we could talk about it. But I would say all of the people that reached out, it just really emphasizes the importance of some of the strategies that we will be sharing during this talk. And before we dig into those strategies, I know Christine also has a story to share.
Yeah, thank you. So I not only come to this topic professionally, but personally too. I mean, doctors are patients too. And I've had my own journey with HPV and navigating abnormal pap smears. So I completely emphasize with the range of emotions that can come up and the stress that can come up and the societal ideas and myths and misinformation that you can internalize regarding this. So for me, I completely understand the range of those feelings. I was in my 20s when I first discovered I was away from home at university. And it was very isolating and scary for me at first. And I didn't have necessarily the best healthcare support at the time until I sought it out and realized I could do more towards helping my immune system and helping support myself. But I think what is important is that like it's extremely common, and I didn't realize that. We have statistics that 80% of women who are sexually active may have HPV. And I'm sure you have other statistics similar. I think it's 3 out of 4 Canadians are dealing with HPV. So, you know, I didn't realize that. And so knowing that how common it was, what really I learned and what were lessons I gained was getting the right information about it, having the right people guide me, the right healthcare team, and then knowing that I was actually through reaching a healthcare practitioner who had access to knowledge about the impact that lifestyle and nutrition could have that really made a difference for me. And so in many ways, this presentation and the work that I've done as a practitioner has been like a love letter to my younger self to really make sure you have the resources that I wish I had available to me back then.
Thank
So,
you for
you know,
sharing. No,
yeah.
it's important to know that it is a very common virus. And so we want to be able to move into some practical strategies. And so on the next slide, I'm going to start with the first strategy here, which is something we've been talking about, which is making sure that you have accurate information. And there's a lot of information out there on the internet, but getting factual, easy to understand information is very, very important. And so sticking with reliable resources, the World Health Organization puts out really, really great information around not just statistics, but research updates and health guidelines. Same for the Centers for Disease Control and Prevention, really great websites as well. So really staying focused on reputable sites and resources is important. And the reason why is because it can help dispel myths and misinformation. And so one of the primary goals here is to challenge and talk about the myths that are perpetuating the stigma. And by correcting these misconceptions, we hope to reduce that stigma and lead for more people to be willing to talk about it and get treatment. So here we're going to ask you all to engage a little bit around some of the myths. There's lots of myths, but I chose 5. And so the first one here is that only young people, oh, sorry, wrong here, that only women have to worry about screening. And so just drop in the chat if you have any comments about that or if you've heard something like that. So right now, this is partly true. So it's a little bit of a trick here, but pap smears are only for women, for the cervical pap smears. We talked about HPV screening is only for women right now. And I know I saw a question in the Q&A. Currently, the HPV screening is not approved for men, but I don't think that that's going to be for long. The way the research is going, there just has to be a process in order for things to be approved officially. But I know that they're working on that. I would say, just to add in here, that some women and some men are in a category where there would be a recommendation for anal pap smears. And so, I can always answer more questions about that. But this one was a little bit loaded for the first one. So for the second one, HPV gives you a high chance of cancer. And so please put in the chat what you think about that, if you've heard that. As you know, the earlier slide that I showed, that the majority actually can be taken care of by your body. And so of all the types of cancers that can cause a lot of fear, cervical cancer is the highest, but the other ones are quite low. third one here, getting HPV means you are promiscuous. And so definitely want to hear some thoughts there in the chat. But HPV is so common that almost everyone who's sexually active will get it at some point, right? So getting HPV is not an indication of poor moral, any judgment issues. It can be transmitted through any form of sexual contact with someone who has the virus.
I
All
love the
right.
engagement, by the way. You might not be able to see it right now, Dr. Nguyen, but people are guessing which are fact and myth,
Okay.
and definitely having relating to these types of things that we hear that aren't necessarily based on truth, and some truth that's really important to know. So it's great.
Yes. No, that's great. I
Thanks for
love.
your input, everyone.
Yes. What about this second to last one here? Having HPV will affect your fertility. I think I hear this one a lot too, and maybe it's because I'm an OB-GYN, but so HPV itself doesn't necessarily directly cause fertility issues. Now, for women, certain procedures that that are required when the HPV progresses, such as a LEEP, which I know is just a fancy word for a procedure on the cervix. Now, that procedure can affect a woman's ability to hold the pregnancy. And so not directly related, but it can be. And then the last one, I can't contract HPV with only having had one partner. So this is a very common question that I get here. So HPV can be transmitted during your first sexual encounter from your very first partner. The virus is highly contagious, so it only requires one instance of intimacy to be transmitted. This is really just important information, I think, to help spread and make sure that your friends and family are aware as well. So,
Absolutely. And we're just hearing in the chat absolutely how that's true. And if you missed the first two, they just want you to review which are myth or fact, if you can just go run down the list. So
okay.
people are asking.
Okay, no problem. So HPV screening is only for women. So that is a myth because there are some changes that we hope to see. So that screening is for everyone, regardless. Number two, HPV gives you a high chance of cancer. That's a myth because we know the majority actually can regress on their own. And we're going to talk about those strategies in a little bit. Number three is a myth because it only takes one time of contact there. Number four, HPV will affect your fertility. That is a myth with the caveat that some treatments for HPV can potentially affect women's ability to hold the pregnancy. And number four, I can't contract HPV with only having had one partner is not true. So you can contract HPV with just having had one partner.
Thank you for clarifying that. And thanks for all of you who were making guesses. And I hope now you have that accurate information, which is what we really want you to have, is that reliable information to guide you. So that reduces your stress and also allows you to know where you can put your focus on being proactive. So that's where I come in to talk to you about self-care strategies to manage stress for your immune system's benefit. Because I want to answer that question, why managing and reducing stress levels is key for your immunity. The nervous system is directly going to impact the immune system. That's just the way the systems of the body work. Stress compromises your immunity and can make you more susceptible to infection as well. And I think we all pretty much know that, but there's a lot of science to show that. So when your stress levels are high, this increases your levels of a stress hormone called cortisol, which has an impact on immune activity. For instance, affecting your gut health, which is where a large portion of your immune system lives. I'm sure many of you have heard their gut is so critical for your immunity now, which is why we talk about the importance of good gut health. I just wanted to share, because we were touching on the range of emotions. This is a study that showed the association between the knowledge of HPV and the feelings that people were having of stigma, shame, and anxiety. It was very real. So if you've had any experiences of that, I certainly did. It's very real. It's been studied. And that's why we want to make sure in healthcare that we're starting to break down sort of the fact that this is causing a lot of stress and we can do something about this and just to normalize that. So some strategies, first step when you're dealing with emotional stress is to identify what are your main stressors, not only, generally, But in this topic, and as we're talking about today, as it relates to managing HPV, so we gave some examples, of having some fears and anxiety or stigma or embarrassment, whatever the tone of the emotion is tuning into what are your stresses, or do you have the right healthcare practitioner, or do you have the right support? All of those things are worth considering. So next step is to then choose safe outlets to express and release your stress and not hold it all in. And we're going to give some examples today about that. So journaling, deep breathing, meditation, exercise, talking to someone that you trust, and then knowing when to seek support. So if you feel you need more tools and guidance, finding a healthcare professional to help manage your stress and mental health, be it a therapist or someone you feel comfortable with. How many of you have used journaling as an outlet? Just share in the chat if that's something that you have found helpful, because there is a lot of understanding now that we benefit from writing down our frustrating or negative emotions, because it helps us process them so that we're not ruminating on them and holding the stress inside, and getting our worries out on paper so they're not filling our mind and thoughts, and that interrupting, our bodily functions and our overall health. So you can journal about past stressors, current stressors, and your personality tendencies as well, and explore that as a way to start to get it out of your mind and not filling your mind. There's a lot of science, as I said, around the importance of managing stress now. And so these are two really big, helpful resources, I think. The Body Keeps the Score and When the Body Says No, written by two different medical doctors, resources about the connection between the mind and the body that explain what can happen to the body if we repress our emotions, including those societal, pressures and ideas that we have. And the importance of having a safe way to be aware of those feelings and release, especially the difficult feelings. So definitely, if you haven't heard of these two books, I highly recommend you explore resources like this as well. And if you have heard of these books or found them useful, please share in the chat. We'd love to know. Deep breathing sounds so simple, but it is so powerful. So, and I'm chose to talk about this as well, because a lot of what happens with HPV is you're in a watching and waiting period in between your appointments and checkups. And even at the day of the checkup, or on, the time building up to that, that's when our stress levels can be higher. So I wanted you to have an immediate technique to draw on to help you. So deep breathing, actually, even just for a few minutes, stimulates a part of your nervous system, a branch of the nervous system called the parasympathetic nervous system, often referred to as your rest and digest portion of your nervous system, that prioritizes your body's restorative capabilities. So a simple technique that helps to deepen the breath is, for instance, there are many different types of breathing techniques. And as a yoga instructor, I'm familiar with many of those. But one that's super simple to remember is just called the 4-count or box breathing breath. So I thought we'd just take a second to do that, where you inhale for 4 counts, take a deep breath in, count to 4, hold that inhale at the top for 4 counts. Imagine you're drawing a box. So you've gone inhale, you're going across, hold it for 4 counts, exhale 4 counts. Big exhale, and hold that exhale for another 4 counts. And then repeat the cycle, inhaling 4, holding it for 4, exhaling for 4, and holding that exhale. So it's the holding and suspending of the breath that really can relax the diaphragm and relax the nervous system. Meditation and mindfulness is also a really important self-care strategy to manage stress. And that, again, directly can help with your immune support and immune optimization. Guided visualizations or meditations can be a powerful tool to shift your mindset and process emotions. And the benefits of meditation have been documented and include reducing inflammation, improving gut health, improving nutrient absorption, which, as you'll see in a moment, is very important. Also, it can aid your sleep, which we're going to talk about, and the importance of sleep as a tool to help you really strengthen and support yourself, and restore yourself. Some Helpful apps, if you're not aware of them, pop in the chat if you've used any of these: Insight Timer, Calm, Headspace. The great thing about these, which I wanted to show you, is that you can actually search up specific words. So this is an example from Insight Timer of searching up immune support or health anxiety support. So really helpful resources there. Now moving on to nutritional and lifestyle strategies, there is luckily a tremendous amount of evidence-based nutritional and lifestyle strategies that can play a significant role in helping to optimize the immune system. So the top three that we're going to cover today are how to improve your sleep quality for immune health, optimizing your nutrition for good gut health, which, as I said, affects your immunity, and being aware of some specific nutrients that support the body's response to HPV. So improving sleep quality for your immune health. In the chat, share with us, is that a challenge for you? I know it is for me as a mother. I'm also a mother as well. I don't think I mentioned that in the intro. Both of us are moms and juggling it all. So getting enough sleep, 7 to 9 or even 8 hours, can improve your cognitive function, quality of life, and make the immune system less susceptible to infection. So ways you could try to optimize your sleep is having a more regular and consistent sleep routine, avoiding stimulants like caffeine after 2 p.m. A lot of talk now about limiting screen time and blue light exposure, ideally 2 hours before bed, keeping your sleep environment dark and cool to help increase your melatonin production, which is a really important hormone that helps you have a deep restorative sleep, and creating a wind down time to prepare for sleep. So for instance, that might be when I know a lot of my patients use journaling to get a lot of those feelings out so they're not hitting the pillow, and then that's what's making them not be able to fall asleep. In terms of nutrition for optimal health, I'm going to share some really big principles here that I think are key for good gut health, and therefore help support the immune system. So when possible, opting for organic. Obviously, it's not always possible, but becoming aware of foods that may be more highly sprayed with pesticides and herbicides, and the impact those can have on our health. So trying to choose the source of your food. Eating the rainbow is an expression when we increase our fruits and vegetables for antioxidants and essential nutrients, what we actually do is create more color in our diet. And so that's where the expression eating the rainbow comes from. So plenty of fruits and vegetables has been shown to be hugely important. Choosing healthy fats helps to balance the hormones, reduce inflammation, and supports the immune health. So avocados as an example there, but getting your nuts and seeds as well. Healthy, clean sources of fish, choosing healthy proteins and sourcing those as well, and getting to know where you're sourcing those from. So whether you're vegetarian or not, making sure you're getting enough protein, that's part of the building block of your immune system. And then limiting the things that could potentially be inflammatory, such as gluten or dairy or foods high in omega-6s, limiting processed foods and sugary foods, and steering clear of refined oils high in omega-6s, pardon me. And so being aware of these parameters. And then there are specific nutrients that have been associated in a lot of research with supporting the body's response to HPV. So the following vitamins and minerals have been related with supporting cervical health and the body's response to HPV: folate, vitamin A, lycopene, vitamin C, selenium, vitamin E, zinc, and additional nutrients derived from herbs: broccoli sprout, green tea, reishi mushroom, astragalus root, AHCC, which is a proprietary formula. And so when you look and you take a step back and see what are the risk factors for HPV, there are some to be aware of and to put into your mind. And one of those is nutritional deficiencies, in addition to all the other lifestyle or health components that you're going to want to consider. So if you have a potential deficiency in vitamin A or folate or vitamin C, vitamin E, selenium, I've listed here some of the foods you might want to increase to get more vitamin A: having more carrots and bell peppers and dark leafy greens; folate, having more dark leafy greens as well, and beans and whole grains; vitamin C, many of us know citrus is high, but so are red bell peppers and broccoli and strawberries; Selenium's a little harder to get. Brazil nuts and oysters are a source, and vitamin E also is in nuts and seeds, as well as beet greens, in case you didn't know. So just curious if some of you are familiar with having a lot of these foods in your diet and are already on this, and if you're not, like where you want to increase those. A really interesting study, as I said, there's clinical research on these particular nutrients, and I just thought that I would share and highlight a couple of these. Out of 58 participants in this study regarding folate, those receiving 5 milligrams a day of folate supplements showed a higher percentage of regression, 83% compared to the placebo group. And so it's worth noting here, some of the studies that really show the clinical research that has shown the importance of these nutrients and for you to be aware of, so that you can consider those as part of your proactive strategy. Other studies worth noting are, and I'm going to just share a few quickly with you, vitamin C and some research around vitamin C and HPV. Vitamin C is obviously a water-soluble vitamin that's been shown to really increase the adaptive immune system. Carotenoids have had studies on them as well. That's the vitamin A source that we were just referring to. So being aware that these nutrients could be a part of, part of the missing piece for you. As well as green tea, which I am sipping on purpose today. I've made myself a cup. Has long been used as a powerful antiviral plant that supports the immune system. And one of the notable active compounds in green tea is called EGCG. And so you'll see that noted in a lot of the studies in regards to it. So I just wanted you to be aware that there are clinically researched ingredients that can support the immune system, and be aware that these nutrients can be specifically helpful for you.
And I just wanted to take a second here to add, Christine, that I get this question a lot, so I want to address it ahead. But you can get these nutrients in individual, supplements. There are some brands that will put everything in ones for the convenience. And so one of the ones I actually recommend a lot to my patients for the convenience is Papilex. And so there's options. I just wanted the audience to be aware.
Yeah, there are many options, and it is important to underline that. Absolutely. Thank you so much. So we're getting to our question and answer period almost, because I know some of you, I can see the questions are building. And if you haven't put your question in yet, please do. But I'm going to let Dr. Nguyen lead us through summary of some of these key takeaways.
Right. So we just want to make sure that there's some takeaways and things that you can act upon once this webinar is over. But strategy one is just making sure that you have resources that you can trust and that they're updated. I looked through the chat and so many didn't know about the home kits for the HPV. So I'm just so grateful that you all are here to help spread the word, and really building that support around you so that the emotional side of having HPV can be, it's a shared experience. And then Christine?
Yeah, and then really emphasizing and summarizing that there are self-care strategies to help manage your stress, which has this wonderful other benefit of supporting your immunity. And by calming down the nervous system, we help support our immunity. And so journaling, deep breathing, meditation, mindfulness, and seeking professional help, as we might share in some stories, sometimes is what we need to make sure we're getting the support we need. And then also really looking at your day-to-day lifestyle and the simplicity of making some tweaks to diet and nutrition and lifestyle for immune support, whether it's improving your sleep or your diet and being aware of certain nutrients that you might want to optimize.
Right. And so these stress relieving benefits, there are stress relieving benefits just from taking this proactive approach, like feeling empowered that you can do something. And hopefully you feel empowered just knowing some of this information today.
Yeah, and I agree. Like knowledge is power. And I always remember that when I was going through my journey, I met a nurse who kept telling me knowledge is power, knowledge is power. And that stuck with me. So focusing on what you can control is really a relief sometimes to say, I just have to focus on what I can control. Creating a customized toolkit that works for you. Like if meditation isn't your thing, but exercise is your thing, then that may be what you need in your toolkit more. And knowing that you're not alone, reaching out for support and resources near you. So just curious for some of you, we'd love to know what your key takeaways so far have been. Like what, from what we've shared, I'd love to just start adding in the chat, what did you not know and what has been, helpful for you? We'd love to know.
Mhm. And while you all are doing that, I just want to take a few minutes because we do have a growing list of questions that I want to make sure we get to.
Exactly.
Is feeling empowered is really important. I wanted to circle back quickly to the two stories I shared earlier. The young woman who reached out to me after several messages back and forth was open to sharing her story with someone outside of her own mind, and so she sought therapy. And it's not a quick recovery, but she's down a path where she's now at least expressing her emotions to someone else who is a professional and who can help guide her. So it's just really important to be open to someone, and that someone can be very different for every person. And then, with the husband who reached out to me, like I mentioned, there was just some information about what he heard, and being able to clarify it allowed him to have that conversation with his wife, and that for them to approach it together.
Yeah, I completely agree. And my journey kind of propelled me in ways I didn't expect. I ended up really researching this topic for myself and ended up studying to become a naturopathic doctor, and went and studied with people in my field who've been leaders in HPV education, and trying to make sure people know that they have many options of supporting their immune system. So I feel like it kind of ended up directing my career in a lot of ways. So as I said at the beginning, I feel if we can just help you learn something new today, or if there's something that you didn't know and now you have that information, or you've clarified a myth and I now have the right information, that can make all the difference in your process and in your nervous system and help you feel more empowered. So we'd love to hear from you, what you've gotten out of this so far. And now we want to move into the Q&As and make sure we answer every single one of them. Before we do that, as a big thank you for attending today, we just wanted to let you know something's going to arrive in your inbox in the next little while, either today or tomorrow. Dr. Nguyen has prepared a helpful resource for you to highlight the key strategies we covered in this webinar, and actually a lot more value in that PDF that we'll be sending to you. It's called the HPV Toolkit. It's a 5-page checklist of key proactive strategies and extra valuable information. Big thanks to Dr. Nguyen for preparing that and sharing that with you as our thank you. If you have already put your questions in, we'll see those. If you haven't, we want to get those questions answered. So if you don't know where to put them, at the bottom of your Zoom screen, there is a Q&A section that's ideal if you can put them in there. And we'll answer as many as we can. We do want to stay, we do want to stay in touch with you. So we're going to leave this up so that you can find here. Dr. Nguyen, why don't you share some of the links you've provided here?
Just really quickly, I'm learning that so many of the challenges we're having are preventable. And so I'm really focused now on helping parents and their teens work through some of these really difficult topics to talk about, so that we don't find ourselves in the state that we're in today. So that some QR codes there for you all to follow and kind of keep updated on what we're doing.
Absolutely. And I've shared my Instagram handle and website as well. So we'll leave that up during the Q&A, so that you have that if you want to write it down or want to screenshot that to engage with us on Instagram or otherwise. So let's move to the Q&A and see what questions we have. And why don't I open that up? So
And just we
yeah,
have
go
about
ahead.
We have 5 minutes to officially, but we both Christine and I can stay on later. We're going to go through this list here. And let's see, do you have it pulled up, Christine? I think maybe the first one you can speak to, and I can speak to the second one here.
Okay, so it's the first one I see is, do you have any suggestions for protecting the partner, supporting the partner's immunity other than the similar strategies as for me? Thank you. Yeah, it is very similar. So as Dr. Nguyen explained, HPV affects women and men and people of all genders. And so all of the strategies I've shared today are for everybody. So anything that you heard today could be useful for your partner as well.
Great. Let me see. The next one is, what does it mean to have a positive 1 year and a negative another? So this definitely is a very confusing part of HPV. So it could mean two things, right? If it goes away the next year, it could be that your immune system got rid of it like completely. We know that over 2 years, 90% of HPV can regress, disappear, go away. But it also could mean that it's sleeping or dormant, right? So that's why the continuous monitoring and screening is so important, so that you are aware of what's going on with your body. But yes, lots of confusion around that for sure. Let's see, I think I can take the next few ones. I did touch on it briefly, but so for screening for throat, like the impact of HPV on the throat area, there's no swab or screening right now. The best way to keep updated on this is through a physical exam at your family doctor and at your dentist. And so your dentist also during the cleaning should be looking for any signs or ulcers or anything that just looks unusual, and then they can help make recommendations from there. Men right now are not able to use the self home test kits right now, but like I mentioned earlier, I really do see that changing very soon. And so I think that takes care of the question around screening. I'll just highlight really quickly that for anyone, and I know this can be uncomfortable, anyone who engages in anal sex, there are certain risk factors where you would and should be getting anal pap smears. And so feel free to reach out to me later. I can go down that whole rabbit hole, but very, very important information. Trying to go down quickly.
Yeah, I know. I think a lot of these are for you. If I had a
Well,
hysterectomy at 40 and I'm getting exposed to HPV at 65 from a new partner, do I need to be screened?
So excellent question. The answer is yes, because you're exposing yourself to potentially a new partner. So being aware of what's going on in your body is important. Now, this is the part where the taboo and the stigmatized health comes in, right? Hopefully you feel comfortable sharing with your doctor that you have a new partner. Because if I didn't know you had a new partner, my assumption as an OB-GYN will be, okay, you're 65. 65 actually is the age in which we start weaning off of screening for women, at least in the US, unless there is a additional factor. So really important to share those information with your doctor and that you feel comfortable so they can really treat the whole situation.
Right, exactly. And similar, like the next question is about if I need to have unprotected sex to get pregnant, is there a way to screen my partner? Would the risk always be latent?
Yeah, very difficult situation, because there's no recommended screening for your partner at this point. If they're male, then that would be something that you all should talk about. And we're talking about HPV now, but this is obviously applicable to any type of sexually transmitted infection. So just having that basic conversation around when was your last testing, what are your risk factors, all of those things are going to be your best option for right now.
Yeah, exactly. And I think we answered this, but is there a test for oral HPV?
Yeah, no, not currently.
Not currently. Okay. And curious if there are any initiatives to change medical practice around screening for oral throat. I guess that's what we were talking about. There is initiative. We don't have anything to share with you on the current updates. Yeah. Yeah. Okay. And a slightly longer question here. I've heard by licensed professional doctors on health podcasts that your typical vitamin panel doesn't necessarily show whether or not you're at optimal levels. Are there certain nutrients we could test ourselves for at home, or should we ask for more specific testing? If so, what should we request? So this is a perfect example of where seeking a healthcare practitioner that's experienced in this area can guide you. You're right, there's different ways of testing different nutrients. We can test some of those via blood panels, but getting someone who might be able to work with you to look at what your diet is like and analyze that is going to be the most specific way I can guide you, because There's many different views and opinions about the best ways to do that. But I definitely encourage you to explore that for sure.
Yeah. Let's see, is the next one, okay, so if I were to get pregnant, could I pass HPV on to my child in the womb? So currently there are no studies that would validate that. And that's why it's so important to stay updated on the ongoing research, because not sure what they'll find, in the future, but currently that is not the case.
Thank you for that. And yeah, a question here about someone going through a difficult journey. I wish I could just like reach over the screen and give you some support. Yes, in terms of needing professional help, and you're asking, who do we recommend? You're in Florida. Obviously, look up, start with your family doctor, see if there's a gynecologist specifically, because that tends to be the field where we get into HPV testing is through gynecologists. It's going to be a question of finding the right healthcare practitioners near you. And as we said, like if you're feeling a lot of stress in regards to this, also seeking mental health support through a therapist or a trusted healthcare provider who you can discuss this with and manage the stress side of it as well.
Let's
Next
see.
question. Yeah.
So let's see, I've been tested HPV positive for 3 years. Do I need a LEAP? So do you need a procedure or an intervention? So no, I would say, the HPV being positive, the next step is to ask or to determine whether or not the cells have been affected. There are cases where the HPV swab will be positive, but the actual pap smear is negative. And so I wouldn't base it on a timeline. In fact, that tells me that potentially your body is doing a good job of protecting itself from the effects of HPV, right? So I would recommend just continuing with the HPV and pap smear testing before doing anything else.
And I just want to respect that some of you may have to go. We're going to stay on though and answer as many of these questions. We're more than happy to do that. So if you do have to go though, please know you will get the replay in an email with our wonderful resourceful PDF that Dr. Nguyen has prepared. And we're super, super grateful that you shared with us. For those of you who've been sharing in the chat, it means so, so much. We want, even if we've just helped some of you have one more resource in your toolkit that you did not have, we're really, really grateful for that. So we're going to stay on, but just for those of you who feel that you need to go, we just wanted to make sure you know that we honor that and we respect your time. So thank you so much for joining us, and look for your emails as follow-up. Okay, I see a question. Would it be more beneficial to take the specific vitamins, minerals mentioned in extracted forms, or should we also try to eat them in whole form, such as broccoli sprouts versus broccoli sprout extract? Certainly both. Both are beneficial. Always starting with food is the safest and most wonderful way to always start as a foundation. And then with, the help of a healthcare practitioner, exploring, which nutrients you might need beyond that and vitamins. I didn't get to share sort of full circle for me, like it just, just making those tweaks. I think I did share, like just making some of those tweaks and understanding what foods and maybe vitamins, if necessary, are made a difference for me. So I think so many people, as you said, can just start with good food and then learn about and become aware of these very specific nutrients that you might need to consider having as a supplement form as well. So the answer is both.
I think I can get this one. This question is about having HPV 16 for a while, starting in the cervix, but now is in different areas of the body, and whether or not the focus on the immune system and taking nutrients such as Papulex would even still work. I mean, Christine, you can chime in, but I imagine, my thought right now, the way I look at it, is your immune system is fighting the virus. So whether the virus is living in different parts of your body, and another question is around anal HPV. So it's really about building your immune system. Christine, do you have anything else to add?
Yeah, I'm not sure what question you're responding to, but so I'm sorry, I missed the question that you're responding to.
Just whether, HPV can show up in so many different ways on our body, and whether or not focusing on our immune system, taking nutrients, such as the ones that you've recommended, like, does it make a difference? Thank you.
Yeah, I think that, when we can change the foundational support for our immune system, it's always going to be supportive. And so, for instance, once you have that awareness and you make some of these adjustments in your diet or taking any vitamins, and you start to track, what's happening in terms of your health, you'll know whether it's worth continuing for you if it's been working for you. But I think that there's a big theme of wanting to, in terms of the patients I've worked with, of wanting to continue to maintain their status quo if they're doing well. And so there's benefit to continuing. And, the strategies that we've discussed could be something that could optimize your health in general. So there's benefit to that as well.
Mhm. Question here about how do you know if HPV is dormant or completely gone? And I touched on this a little bit, but I'll just re-emphasize here because it's just such a common question. And the problem is that you don't know. You don't know actually all the time if something is a reactivation or a new strain. Now, if it's the HPV testing doesn't test for every single strain. Remember, I said there was like 100, 200 plus. Now, if it happens to be one of the strains that they are the test does test for, then you could have a view through of whether it's a new strain or not. But just keep in mind that the test does not test for every single strain, and so you wouldn't be able to say for sure with certainty that it's a strain that you've had that's reactivated or it's a brand new strain.
Mm-hmm.
Um, Okay, well, I want to touch on this real quick for, is there been any benefit in getting the HPV vaccine after you've been tested positive? And so, for those who believe in getting vaccines, I would say the studies have shown that the vaccine is helpful because it's helping prevent other strains that you haven't, caught yet. And so even if you've tested positive, say for 16, there's still 18, 45, and other strains. And so that's definitely something to talk to your doctor about.
And I think that we touched on this, but someone just didn't hear. So if you've had a hysterectomy, is it still important to be screened, and are you at risk?
Okay, great question, because again, we never make anything simple. So hysterectomy can mean a few different things to some people. So hysterectomy, where you've removed your uterus and your cervix, then if you've had no history of abnormal pap smears, then you actually do not need further screening. However, some people get their uterus removed, but their cervix stays. And so just really making sure you're very clear about your medical history is important, because if you still have your cervix, then we still should be screening.
Mm-hmm. Mm-hmm. And it's another question. Maybe I missed this in the present. Does HPV make you feel symptoms like tiredness and other kind of symptoms? So some symptoms you might not notice at all. And depending on the progression of the situation, then I guess Dr. Nguyen can answer that more specifically. But I think that's the part that is challenging for some people, is that they don't feel different, but their test is showing something. So you can add to that.
Yeah, no, absolutely. That's correct. I mean, the majority of HPV does not cause symptoms. Once something is causing symptoms related to HPV, it's probably showing some form of progression.
Mhm.
Let's see. I think we have a few more.
Yeah,
So,
we do. It's great.
can
Thank you
you
so much for bringing all these questions to us. We're doing our best. And if it doesn't get answered, we'll do our best to, follow up if we can.
Yeah, no, absolutely. Can you pass high-grade virus back and forth between partners? And if you've had a procedure for CIN3, which just means a progression in the cellular changes, and the virus went away but comes back 10 years later, was it reactivated due to chronic stress, such as getting cancer, or did your partner give it to you? So, there's so many studies that have looked at cohorts of partners to try to answer this very question. And this is not going to make you happy, but some of the studies I read basically show that the passing of viral strains between partners is lower than they expected. And then there are some studies that show a higher, what they call concordance, meaning it's back and forth, back and forth. They believe it's probably related to the strain type, and also probably the health of that individual. And so that really explains why the studies are not really showing one strong view versus the other. And so your question, unfortunately, there's no good answer whether or not it was a reactivation or not. But just keeping in mind some of the things that we talked about today probably played a factor into it, right? Like you mentioned, the stress. And so I'm sorry that the answer is not super clear, but a very common question that's continuing to be studied.
So interesting. Thank you for sharing, enlightening us about that. That's useful to know. The next question is the pap smear the only way to test? We've talked about the new HPV testing that's going to be a really critical part of testing. And also, is for anal HPV, does it cause colon cancer?
And so, unlikely, they cause different types of cancer. And so, the anal HPV more commonly will cause anal cancer in the rectum, the lower part of the GI tract.
And a question about, can it be transmitted, but non-sexual contact, kissing skin to skin? Yes, I think we did answer that earlier in the presentation. It is highly contagious, even from skin to skin. Yes. And the next one, can HPV spread from one part of the body to another? Like if I have it on my cervix, can it spread elsewhere, not through any contact with another person?
So it's a great question. And there are some studies that show that you can spread it to other parts of your body. So just making sure that you're aware. So depending on whichever, whether it's an activity with another person or just with yourself, like just being very aware of, the areas is really important.
Mm-hmm. Interesting question here, like sort of saying in the medical system, I'm not sure where they're referring to they, but saying not to worry about having HPV, but they say it's not curable, but your immune system can cure it. So I think they're trying to say, like, the myth and the facts. So these are big words that we're talking about there. I think that we just want to emphasize that there are strategies and that there are proactive ways you can support yourself, but the medical system is doing everything it can to find better testing, providing more components of options for you to address that, vaccines being a component of that. And so I hear your frustration, though, that it tends to be misinformation. And so thank you for asking that question, because we do want to provide some positive message that there are some things that can be helpful depending on what stage you're at.
Yeah, and I'll just add that it's I get that question a lot about why physicians, like OB-GYNs like myself, tell and encourage people to not worry. And I'm learning that that's probably just not the best phrasing, right? Because you can't tell someone not to worry; they're gonna worry. But that's the part about empowering yourself with the right information. And so, I mentioned earlier, if you're young and healthy and you're taking care of your body, there's such a high percentage that your body will take care of the HPV, like up to 90% over a 2-year period. And so I think when clinicians are saying, don't worry, that's really maybe needs to be rephrased to that more of that information, because there is no pill that we can give to cure it. So it's correct that you are saying that you're hearing that it's not curable, but that does not necessarily equate to that you can't do anything about it. And hopefully that was some of the things that you were able to take away. But thank you for the question.
Yeah, and that's a really valuable clarification of, the communication around it is so key. So thank you for highlighting that. And so as a patient, you really do have to be proactive and ask ask the questions and make sure that you redirect the conversation if you need more information, and advocate for yourself for that. Okay. I think we have time for a few more. I think we're overwhelmed with these questions. It's amazing. So
Let's see.
go ahead.
Go ahead. If you see any that aren't repeated, we can definitely.
Yeah, there's some that are repeats. So we're trying to focus on the ones that might be new questions. We talked about hysterectomy again there. Okay. Think.
Um, this one, let's see, can you get oral or anal cancer from HPV if you don't participate in oral or anal sex? So unlikely. So, because it's directly transmitted from skin to skin. So if that area is not being exposed, it just definitely decrease that risk for sure.
Mhm.
And can you still give HPV to your partner if you're no longer testing positive? Again, unlikely, because that HPV is not even at a detectable rate anymore for the test to detect it in your body. So unlikely that you're transmitting it.
Right. Right. Okay. I think we got through most of them. And if we did not get to your question, we are happy to answer it outside of this timing. If you are looking for support and need some more resources as well. So you will be receiving some email follow-ups from us with the resourceful HPV toolkit, as well as the replay. And that's an opportunity for you to reply and, connect with us that way, or individually if you'd like to. I think we've covered all of the topics that we wanted to. I just want to highlight that we got some really nice supportive comments in the chat. Excellent presentation and useful information. Thank you both. Most helpful, someone said, really leveraging the mental health and managing the emotions and feeling less guilty are key things I learned today. Thank you so much for clarifying the myths and helping me feel empowered. So thank you for your comments. This means so much to us because we really both, really put our energy into this. Another thank you coming in. Thank you so much. We're really appreciative. And we don't want the connection to be lost. So stay in touch with us. That's why we've got the stay in touch screen up here if you want to connect. Are any final words you want to share, Dr. Nguyen, or any thing we missed that you want to just touch on before we wrap up?
And no, nothing that you haven't covered. I just really want to thank everyone for their time. I think it makes it worth for the several hours that in weeks, actually months that we've been preparing this, because we know that it's a hard topic to talk about, and we want to help normalize it as much as we can for our generation, but specifically for our kids growing up. Like, they don't need to go through things that are controllable and preventable. So thank you, Christine.
I agree with that, Dr. Nguyen. And as I said, if we just helped one of you or many of you, it sounds like to have some more tools in your toolkit, that's what made the difference for me. And that's why I'm taking the energy and time to really make sure people have access to these resources and have have an awareness about some proactive and empowering strategies that can not only help your body, but also help you manage the emotional stress, which is what we really wanted to focus on today, and help you feel calmer and more confident and more competent with having the right information, so that you can have the best outcome. And we absolutely wish you all the best outcome in your journeys. So thank you so much for being here. We're going to wrap up now and look for the emails from us with the recording, with the valuable toolkit PDF we'll be sharing, and stay in touch. And if there's anything else we can help you with, just reply to that email. So thank you so very much. We really, really appreciate it. Thank you, thank you so much, Dr. Nguyen, for your time and energy again, for all of this collaborative work. I feel like it's the beginning of many other talks that we could do. I feel by the response, we could definitely share again and just have a full Q&A session. So maybe that's our next step. Okay. Thanks so much.
Have a good one.